Hi, I'm Dr. Giavonne Rondo, local internal medicine physician, owner of GObile MD, and your host of Healthy Mind, Body, and Spirit, a show that's focused on the improvement of the entire world, but with a particular focus on the African American community here in the Kentuckiana area. We talk about all different types of topics: high blood pressure, diabetes, racism in the medical field, stress, women's health, all different types of topics, men's health included. Today we have an extra special guest today, Dr. Phillip Williams, a dentist, a local dentist in our area. Dr. Williams, tell us about yourself.
Well,
Welcome.
I have a private office. It's on 25th and Market. Been in the same office for 43 years now.
Wow.
That's a long time.
That is a very long time.
I graduated from the University of Louisville in 1977, and about 6 months after our graduation is when I opened that office, and that was after I did a brief term with Dr. Madeline Hicks.
Okay.
You know, I was the third. Well, there's two African American males who graduated from the University of Louisville in 1977. Was one, and also Dr. Leon French. You know, and we're the third and the fourth, and before us, there was a Dr. Harold Howard and Dr. Madeline Hicks, and so we started it off. And the time that I opened my office, there was probably 3 or 4 black dentists in the West End at the time.
Oh, wow.
Yeah.
Wow.
There was.
Was that in the late 70s, early 80s?
That was 1977.
I'm sorry,
and at that time, when I actually opened my doors. It would have been November the 15th, 1977.
Wow. So almost your anniversary.
Yeah, it's
Okay,
definitely
okay.
that. Yes,
Okay.
it is. So, I mean, I do general dentistry. That means anything that I feel comfortable doing. You know, I don't do braces, but I do everything else.
So none of these, huh?
No braces. That's one part of dentistry that I leave to a specialist.
Okay.
Yes.
Okay.
And you know, there's you know, I have an associate that works with me in that office.
Okay.
And we are still planning to, no plans for retirement yet.
Wow.
Yeah.
So you are every day making history, Dr. Williams, in West Louisville. So that's just amazing.
Thank you.
Absolutely amazing. To be there, to be in West Louisville for 43 years, that's just absolutely amazing.
The time passes fast.
Yes, yes.
Doesn't seem like it was that long ago, but you know, I did the math, and it is. It's actually 43 years.
So what drew you into the field of dentistry, Dr. Williams?
You know, I feel like everybody has a calling. Dentistry was mine. You know, you know, I mean, just you know, I'm a spiritual person, and I believe that God directs you. You know, in what He has sent you here to do, and mine was dentistry from the early years of my life. There was things that I call things that sensitized me to teeth, like my baby teeth were rotting out. You know, the entire group of them, and then you know, me learning, because I was so embarrassed by what I saw, I had to learn how to get them out as quick as they got loose. I got them out.
So your baby teeth were rotting?
Rotting, yeah. I mean, when I was growing up, I lived in rural Kentucky, down in what was Summersville, Kentucky. Greensburg is where I went to school from the 1st grade to the 3rd grade, and well, we didn't get a toothbrush until we made it to 1st grade. So by then,
wow.
sorghum molasses had eaten my teeth up.
Wow.
I lived with my grandmother, and she always made sure we cleaned our teeth, but we didn't have a toothbrush, so we washed them with the same rag we washed our face with.
Oh, wow. So back then, okay, so there were no toothbrushes, or
Well,
you didn't?
I didn't have one.
Didn't have one.
You
So you just used a rag to?
just use a rag
Okay.
to wipe your teeth.
Okay. But isn't that what you all advise for babies before
Yeah.
the age of 2?
Yes.
Okay.
Yeah, that is a way to help prevent, any type of issues because they usually don't want you to stick anything else in their mouth.
No, I know.
I
I got
personally firsthand.
Yes, I know for
Yeah.
sure.
Yeah,
Okay.
so that was one thing that sensitized me to teeth. The other was I was Army brat. My mom got married when I was in 3rd grade, and we moved to Germany. So there we had a dentist in our school. Every child in the school was given a task. My task was to help the dentist.
Really?
Yeah, so that goes to show
is
you
really
that
neat.
when God directs you to go one way, you go
Look
that
at
way.
yeah, look at that.
Yeah, I mean, and
Wow.
I always liked health. Period. I was always interested in bones and anatomy, and so that was my my direction was toward the mouth. And
Okay.
I think that eventually when I chose a field, it was only natural to be attracted to dentistry once I figured out that I possibly could make the grade.
Wow.
Yeah.
So it sounds like a lot of different things came to play that showed you that dentistry was really your calling.
Yeah, I think so.
Yeah.
Yep. I do believe that was what gave me my interest in dentistry.
Okay.
Yeah.
So you've brought a few items that we can kind of look at here. So in the field of dentistry, what kinds of things do you see for the most part? What kinds of things, are you evaluating, when you're looking at the teeth overall?
Well, basically, I'm a preventive dentist. So that means I'm looking to find out what kind of care you're giving yourself at home. So I want to see, just how well you're cleaning your teeth.
Okay.
And I make sure that each one of my patients is aware of the significance in doing good home care. You can come to the dentist, but you spend most of the time away from the dentist.
Yes,
So that
yes,
by
thank
the time, so by the time you get to to the dental office, there's a lot of damage that's been done. That's basically what we're looking for, is anything that is that's going on in the mouth.
Okay.
And then we want to educate you on what happened, why it happened, and then work on preventing anything of the same problems to reoccur over and over again.
Okay. So just by looking in the mouth, you can tell a lot about a person's health.
Yes.
Just by looking in the mouth.
Absolutely.
Okay.
Yeah, you want to definitely, you want to pay attention to, to the things that are visual, but you want to use X-rays.
Okay.
And then there's periodontal examinations that
Could
can
you
give
explain what a periodontal?
periodontal examination is the reading of the pocket depth around a tooth.
Okay.
Like a tooth has, you know, has six sides, basically, five sides,
Okay.
basically.
So we're looking at kind of
And-
like here, and then just looking at all the different
Different
sides
sides.
here. Okay.
And, you know, the pocket is tissue that surrounds the tooth.
Okay.
And normally a pocket, you know, that you're going to be reading with a perio. I didn't bring a perio probe, but, you know, the pocket that you reading, usually a healthy pocket is from 3 millimeters to 0 millimeters.
Okay.
Yeah, and you think of you know, of a food particle of being capable of going down 3 millimeters.
Okay.
The mouth is self-cleansing when it's 3 millimeters or less. So that's what we're looking for, is anything that goes down further. Food can go down as deep as those pockets are.
Okay.
So that tells you a lot.
So you're measuring how far down something can go.
That's right.
In terms of inside that recess.
Yes.
Where the gum, between where the gum and the tooth actually sit.
Where the
Okay.
where the bone starts, you
Okay.
know, that pocket, the tissue starts up, and there's a collar of tissue surrounding that tooth, and you want to know just where the bone level is.
Okay.
By the depth of the pocket, you can determine if the fibers that hold that tooth in the socket have digressed, if they have dropped off any.
Okay. Is that why you all, the first thing that you all normally do is bring that nice little, this horrible probe
well,
here oh, I tell you, when I see this, I just shudder. So tell us about this
Well,
here.
that's like an extension of your tactile sensibilities. You know, you learn to, you notice these are these two items are used in every examination,
Yes.
throughout every appointment. And this is a mirror that allows you to basically see inside the mouth without putting your whole head in there.
Okay.
And then, of course, our little Explorer, it's called.
So that's called an Explorer.
That's called an Explorer. And that's what it does, it explores. You know, it can pick up like fillings that have an overhanging margin. It can pick up decay, caries, you know, the holes in the teeth, usually down in pit and fissures. We usually use x-rays to check interproximal decay, which are cavities between the teeth.
Okay.
But this is like an added tentacle, you know, that gives your
An extension of your hand, basically.
Yes.
Okay.
And it sends all kind of information, you know, back to me when I use
As
this
you're going
properly.
around. So you can just better determine what's going on deeper than what you can actually see, so you can kind of feel
on surfaces
areas
that aren't visible to the eye.
Okay.
You know,
Okay.
this, you know, like basically interproximally and into pit and fissures of a tooth, you can determine if they're soft spots. You're looking
Okay.
for
Okay.
any decay, and that the Explorer, there's a reason it's so sharp. You know, enamel, you can't drop into enamel with that.
Yeah.
Unless there is a violation of the enamel, if there's
Okay.
something that has eaten a hole in it.
Okay. So enamel, that is, am I correct? It's the hardest substance in your body.
That's
so
right.
if there's a portion that's soft, that means that it's decaying or
Yes.
there's damage there.
Yes,
Okay.
you're looking for the advancement of decay into the
Okay.
tooth. So that is used to determine where those areas are.
Okay. And what contributes to that? What contributes to decay, or what are the things that we need to be
if you
staying
are
away from?
cleaning your teeth in not sufficiently, you know, if you're not cleaning your teeth effectively, then you're leaving for the bacteria food or the ammunition they use to make the things that are harmful to the teeth,
Okay.
which are toxins and acids.
Okay.
You know, the acids burn the holes in the teeth, the toxins irritate the gums. So you don't want either one of them. You don't want to give the bacteria a chance to form either one of those.
So for the most part, like sodas and a lot of sugars.
The bacteria has a easier time breaking down carbohydrates into acid
Okay.
and the toxins that are harmful to the body. You
Okay.
know, more so than carrots and celery and, you know, types of foods that aren't filled with carbohydrates.
Okay. Okay.
Yeah, so you want to stay away from sweets as much as possible, but you know, you're looking for any damage that's been done to the tooth, you know, when you're doing the teeth are the beginning of digestion. You know, without teeth, you know, the foods that you eat, you wouldn't get much out of them. You know, you have to first you have to break the food down into a form that the stomach can do its job,
digest, right.
and yes, and then that the intestines can do their jobs. You know, and without healthy teeth, you have a problem doing that.
Okay. How do we keep all of our teeth? What's the best way? And is it true that we can potentially keep our teeth until we're 100, or is that just something that, you know, is not going to
Sure
happen?
can. I mean, I don't expect to lose any of mine, you know,
Okay.
and that is the attitude I have with anyone that walks through the door, is to help them get the information that they need in order to have a healthy oral cavity.
Okay.
You know, and that means adequate removal of the plaque and you know, and you know, and then you have to keep your diet sufficient also.
Okay.
You know, so basically you want to use a toothbrush and dental floss sufficiently
Okay.
and consistently.
Okay. So from what I understand, it's by twos. Like you start at the age of 2, start brushing. You brush at least twice a day.
Mm-hmm.
You need to see someone like yourself, a general dentist, twice a year.
Twice a year.
And then you should actually be brushing for 2 minutes.
Yes.
Every time you brush for 2 minutes. So
Yeah.
that's how I kind of remembered it, the
Yes.
rule of twos,
Rule of
basically.
two.
Yeah.
Okay, that's pretty good.
Yeah. And then how many times should you floss?
Every time you brush.
So we should be, like, if I'm brushing twice a day or 3 times a day, I should be flossing the same
That's
number
right.
of times. Okay.
A tooth has 5 sides. The brush only reaches 3 of them.
Okay.
The other 2 sides have to be flossed in order for the tooth to be adequately clean.
Okay. Woo. Oh boy.
So, and the instructions are that you want to, you know, you want to clean your teeth. It takes about 24 hours for the bacteria to break the food that they get to, the plaque, down into harmful ingredients. So as
Okay.
long as you're brushing at least once a day, but you always shoot for the top, you know.
Okay.
If you put food in your mouth, if you didn't eat, you wouldn't have teeth problems, you know. But we know we must nourish ourselves.
Right, right. It's important for our nourishment, that's for sure.
Yeah. So you want to definitely, use that information, you know, in order to, you know, make your decisions.
Okay.
Yeah.
And fluoride is important to keep our teeth as optimal as possible?
Yeah,
Okay.
there's a push, not only here in the United States, but throughout the world now, to get away from chemicals. You know, there's products out there that are offered that are made from natural ingredients.
Okay.
You know, they're plant proteins.
Okay.
And those proteins have adequate ingredients to help combat the action of the bacteria and to
Okay.
cleanse naturally your teeth. You know, fluoride when I was in dental school was I mean, it was like religion, you know.
So what is fluoride supposed to do?
It's supposed to harden the tooth.
Oh, I see. Okay.
Yeah, and
okay.
to make it less penetrable
Okay.
by acids. You know, but the thing is, you know, there's, in my opinion, you know, there's things that fluoride, you know, in Europe, now they've taken out fluoride. They have banned fluoride from their dentifrices.
Oh, wow.
We haven't done that here in the United States yet.
And they've banned it because of?
Because of harmful, the possibility of harm. We, you know, there's any chemical that you put in your body is going to have a negative effect. Fluoride is the same ingredient you put in fertilizers and in insecticides, and you know that you don't want it inside your body, in my opinion. You know, I mean, but I was in dental school, that was the information I was given, so that was what I talked about up until about 5 years ago.
Okay.
You know, and a friend of mine created a product made from plant protein.
Okay. Could you talk more about that? So it's a patented product that,
Yeah,
it's a dental cleaning product?
It is
Okay.
a dental cleaning product that I've been using it for 3 years.
Okay.
And, you know, it does what we intended it to do. I was one of the founders of the company. And the inventor of the product is, his name is Charles Johnson.
Okay.
And he has sought the patent for the we call it ProTeeth is the name of the product. And
So it's for the teeth, huh?
It's for the teeth.
Okay.
And it is ProTeeth has been, we fortified it with some vitamins and some other enzymes that help combat bacteria. And the result is a product that is not harmful. You know, if swallowed, toothpaste, if you swallow toothpaste, there's a warning on the label on the tube that says, you know, go immediately, you know, to the doctor, to the hospital, you know, because it is poisonous. You know, so I guess they have to put that on the product.
A disclaimer, just to,
just in case somebody has an adverse reaction to
I
it.
have yet to see anyone who has been, who's had problems with swallowing toothpaste, but you just never know.
You never know.
Yeah, you never know.
So I guess they put that there for
just to cover themselves.
Just to cover themselves legally.
Yeah.
But you know, I'd say people want another choice. I mean, we're getting away from chemicals in our hair, you know, chemicals in our food.
So it's really more of a natural, what you're talking about is more of a natural product.
Going back to something that the body can use, and there's no definite damage being done from what it is that you're using, especially something like a dentifrice that you use 3 times a day.
A day, yeah.
Yeah.
Okay.
So,
Well, that's something that's new with our viewers to know about ProTeeth. So we'll need to look into that more.
Yeah, there's a website, proteeth.com, that you can go to and read more about it, but don't want to make this about, you know, ProTeeth.
Right. So it sounds like you not only, you know, work in the field of dentistry, but it sounds like you have some entrepreneurial kind of, you know, focus with that. And being in West Louisville, that's just an amazing thing. So many wonderful things going on in West Louisville that we don't even know about. So you're almost like a hidden figure.
Yeah.
So we appreciate you.
You know, let's just say that is something I always wondered about, you know, and I'm a health conscious person. So, you know, I try to eliminate anything that causes a bad reaction in my body.
Right.
I get away from.
Okay.
You know.
Okay. Well, just looking at some of the things that has been going on just locally with this pandemic that we're in right now, how has the pandemic affected, COVID-19 pandemic specifically, affected you and your practice?
Well, there was, during the quarantine, the 1st of March, we stopped doing routine dental care,
Okay.
and we only did emergency. We stayed open. A lot of dentists shut down then because, well, yeah, I mean, we didn't know what the outcome was going to be at that time.
Right. And then you're so close to people. I mean, you know, with the whole nasal.
Definitely are
yeah.
on the front line.
Absolutely. Not just front line, you're front face.
Yes,
literally,
right.
you know.
So we only did emergency care. I stayed open because I wanted the patients to have somewhere to go where they could get something done about a routine dental problem, an emergency problem, and rather than to go to the emergency room where you know they didn't know what to do for them. So
probably more dangerous than anything,
and
especially during a pandemic.
Where
yeah.
the pandemic was definitely you were going to come in contact with, if people were sick, that's where they were going, to the hospital.
Okay. And then how have the protests affected your practice, if at all?
I didn't have any significant changes from the protests.
Good.
You know, other than a lot of patients not wanting to come into the area where I am. You know, so we had some cancellations that way, but we weren't affected by any damage being done to our property or any harassment to the employees.
Good, good.
Yeah. So, but you know, there was some people that were afraid to come into the area because that was the area where the protests were centered.
Right, right.
Yeah.
Well, you're still here, still going strong, 43 years, so
Yes.
it's a wonderful thing. So we've talked a lot about dental health, about dental care, and you know, so just some different things that we need to do for our overall health when it comes to our mouths. So we talk about it, but we also like to be about it.
Yes.
So what?
Yeah, I think that we should be proactive. You know, there's your business was right on time for me. I was looking for a primary care physician that could kind of monitor, you know, all the other areas of specialists that I was seeing, and you know, I think that came right on time.
Referring to the GObile MD, that
GObile MD, yes, ma'am. So
Yes.
that was very much right on time, and I think that is what where a lot of, especially black males, we're not proactive. We don't follow up on things.
But that's going to change. That's changing little bit by little bit,
I hope
bit by
so.
bit. Yeah.
Yeah, you know, because you know, you want to find things while they're treatable. You know, and you know, staying under a doctor's care is very important, and being directed, you know, by an experienced, you know, and a conscientious physician is the best way to do that.
So that is definitely very important. We definitely want to take care of everyone in the community. But, you know, when you're a caregiver, sometimes, you know, that can be neglected.
Yeah.
So we like to hear that our caregivers are taking care of themselves as well. So that's
right.
wonderful. So you're basically seeing your primary care physician,
Yes.
you know, making sure that you take care of yourself.
Yes, proper diet.
And eating well.
Yeah,
Okay.
proper rest, and
Very, very important is that rest
and
as
staying
well.
away from anything that will harm you.
Okay.
You know, it's all right to have a glass of wine every once in a while, but you don't want to, you know, make that, you know, the main thing
Not
you
all
do
the time,
every
right,
day.
right.
Yeah.
Well, and we didn't mention it, but tobacco and alcohol can have effects when it comes to the teeth.
It sure
just
does.
overall, yeah.
Yes, I mean, you want you know, be aware that if you smoke, there's a breakdown of the tissues that hold the teeth in place.
Oh, wow.
Yeah,
Okay.
and it doesn't matter whether you're doing good oral hygiene or not. It's better to have good oral hygiene, but
Right.
bad oral hygiene and cigarette smoke can take your
Oh,
teeth.
so that's really,
Yeah, so it has
yeah.
a very bad
Yeah.
effect, as well as alcohol.
Right, and not to mention the staining, because
Yeah.
I know my daughter in particular wants to focus on very bright white teeth, and
Yes.
so smoking and drinking alcohol could potentially affect that. So
That's right.
yeah, so that's definitely something that she wants to know about, so that'll incentivize her to avoid tobacco and alcohol use. So yeah,
Right.
awesome. But yeah, so that's one thing I know that, the teeth are, structurally very important, but sometimes people, vanity-wise, do tend to, focus on the whiteness and
Yeah.
aesthetically. So yeah.
Yeah.
Well, thank you so much, Dr. Williams. This has been a
Thank
wonderful
you.
conversation. I know it's been quick and everything, and we have so many more things to talk about. So maybe we'll have you come back to our show with Healthy Mind, Body, and Spirit. A show, like we said, is dedicated to the improvement of our entire world, but with a particular focus on the African American community. Thank you so much
Well, thank you for having me.
for coming on today. And remember to take good care of your teeth. That is important for your overall health, starting at the age of 2. Brush twice a day. See your dentist twice a year. And do that for life, to keep as many teeth as you possibly can.
Yeah.
Yes, and and also do it for 2 minutes. Brush your teeth for 2 minutes.
Yeah.
So this is Healthy Mind,
Brush
Body, and
and
Spirit.
floss, you
I'm
said.
sorry, brush and floss for at least 2 minutes.
Yeah.
Again, this is Dr. Giavonne Rondo with Healthy Mind, Body, and Spirit. Truth, justice, power. It's TV our way.